Welcome to Startup Health TV. I'm Logan Plaster. My guest on today's show is Kyle Kaiser, the CEO of RX Review, which joined Startup Health in 2013. Kyle and his team are all about data transparency, bringing that transparency to the doctor-patient relationship, really to the moment where the physician is making a critical decision about a patient's health. A big piece of that is drug price transparency, knowing what to prescribe and how much it's going to cost. But there's also data that's super important around your insurance and the location of the pharmacy. The idea is to bring all of that data, which is changing so dynamically, and put it in the physician's hands in real time so that they can make the best decisions possible and improve care for the patient. In our conversation, Kyle will explain exactly what they've built and tell us how, even though they've had great traction, they are barely scratching the surface about what's possible when you leverage transparent data for the benefit of patients. Stick around.
Great.
Welcome to Startup Health TV. I'm here with Kyle Kaiser, CEO of RX Review. Kyle, thanks so much for taking the time and being with me today.
Thanks for having me, Logan.
Before our interview, I was taking the time to look over some previous material that we've done with RX Review, and it's just been an exciting journey, and I'm excited to hear what you're working on now.
Great. Yeah, looking forward to it.
So you've been in the drug price transparency game since, I like to say, before it was cool, before it was as mainstream as it is now. Now this feels like an idea whose time has really come, but that wasn't the case necessarily 7 years ago.
Yep.
And you're really well positioned for where we're at now. But for folks who don't know what RX Review is, start by just walking us through the product and what you've built.
Sure. Yeah. I mean, at a high level, think of us as we help better decisions happen at the point of care. So historically, there have been clinical decision-making moments that are between the patient and the provider. And those were rarely, if ever, informed by real-time patient-specific data about the cost and coverage restrictions that may exist for those choices. So what we've built is a data network that connects some of those silos into that moment, creates that decision at the point of care, allowing the prescriber to understand the cost implications of the decision on the patient and what restrictions might exist based on the benefit design, and really trying to resolve some of those things upstream. And, we think that's most important because ultimately it's the patient and the provider relationship where the most meaningful trust exists in the system. Patients seek out conversations with their provider. They tolerate conversations from their health plan or other entities, right? So we want to empower that, and we want to make sure that the providers are able to provide that type of insights when it matters most and when the decision can be most efficient for the industry.
Walk me through what the experience is like for the provider at the point of care if they're using RX Review.
Sure. Yeah. So let's use prescription drugs as an example. That's been sort of our long-standing work. So inside of workflow, a medication would be selected. Once the prescriber is sort of diagnosed, whatever it is they're treating, they select a medication, they place that in a pending status. That's before it's actually signed and sort of released into the wild. It's placed into this pending status. That's when we have an opportunity to evaluate it. And then we evaluate that against our network of payers and PBMs who can provide us specific, pharmacy-specific and moment-in-time specific insights around the cost of that medication for the patient and what restrictions might exist. Even more helpfully, we also get back alternatives to consider, right? So lower cost choices for drugs, lower cost choices for pharmacies, and it's really helping improve that decision the first time rather than having to rework it when it gets to the point of sale.
Got it. So any prescriber who's watching this is going to realize kind of how this differs from the standard of care, but kind of for everybody else, help us understand what challenges the physician typically faces at that point of care when they're dealing with prescription drugs.
That's it. Yeah, that's right.
So tell me what that actual experience used to be, or what it is for folks who don't have RX Review.
Yeah. So the old way, think of it this way, we were flat files moving back and forth from one entity to another. So literally, CSV file was moving from the plan sponsor to their TPA, from their TPA to their PBM, from their PBM to an intermediary, from their intermediary to an EMR. And then we hope and pray that the provider site would download that file with some security so it's up to date. So even when that process was perfect, right, that's going to have a data lag associated with it. And then inherent in that process is it's not patient specific, it's not pharmacy specific, and it's not relevant to that moment in time. So the reality of what happened before real-time benefit is clinicians ignored the data, right? Like they didn't trust what they saw. They didn't understand that it was reliable. So they just stopped seeing it. And we've actually done some surveying and seen that they don't even know it's there, right? Prescribers they've ignored it for so long that they've discounted it as a thing, and it's not even a part of their thought process at this point.
Yeah.
So it's a complete shift in how we communicate with prescribers during that decision-making process.
Yeah, completely. I mean, I can just think of so many situations where physicians would be prescribing relatively blind compared to that kind of real-time patient data that you're talking about. And talk to us about the power of a clinician having cost data in front of them. I mean, so often a physician is divorced from the cost of the care that they're providing. And so they can't give any kind of counseling around cost effectiveness or, hey, this would be just as good and it's a little cheaper. Like those conversations are really hard to have because they just don't have real-time transparency. I mean, how impactful do you think that could be in that relationship?
Yeah, I mean, I think the biggest opportunity is there's a ton of scenarios where the physicians don't have strong opinions on which of the drugs in a same class that they're going to choose.
Exactly.
Or even, beyond through classes, there's therapeutic equivalents across classes where a prescriber just needs to know which one is appropriate for this patient and this payer and this formulary. And that's the part that's hard to figure out for them, right? They're impossible even because it's, 40 different permutations of that decision in a given day in a clinic. So it's just one of those problems that technology should solve and can solve and is now solving at scale, which is something to celebrate.
Speaking of now solving it, I'm curious what your thoughts are on the maturity of this market. I mean, from drug price transparency to patient portals to one-day delivery, pharmacy tech seems to be taking off. On the other hand, maybe are we just barely scratching the surface of it? So like, where do you feel like we're at in this pharmacy tech process?
I think just getting started. I think the opportunity to drive shared decisions, and I'd probably extend it a little beyond pharmacy tech, and that's maybe a self-serving expansion. But these transactions are going to happen across the continuum of care. They're not stopping at pharmacy, right? We're going to know this type of patient out-of-pocket cost and coverage information for everything, right?
Explain what you mean by that, because I do think of RX Review. I do associate you with prescription drug pricing and transparency. So explain how you're kind of expanding the scope.
Well, and just more in the right, that the industry's going to move and is already moving into these areas that are beyond pharmacy. So that might be cost and coverage decision making around other services, labs, radiology, surgery.
Got it. So it's price transparency writ large.
But specifically at the point of care, I think is the thing that's changing, is driving that decision to the point of care is the idea whose time has come. Because there was a whole wave of consumer oriented, member oriented, or patient oriented price transparency that happened years ago. And what's, I think, more meaningful is now that's happening at the provider's fingertips. And ultimately, that's how we drive the most value in this market, is because the referral patterns aren't going to change until the prescriber or provider behavior changes, right? Like that's where we start to maximize the value of this. So that's sort of thing one, is expand beyond pharmacy. Thing two is there's just, we're still an amoeba crawling out of the soup as it relates to some of these transactions, right? And so these are going to become more sophisticated over time. We're going to have more understanding of the patient's responsibility. We're going to have the ability to sort of solve problems that are really specific and relevant to patient out-of-pocket costs, because as consumer-driven healthcare, is now the way of the world, right? And high deductible health plans are more and more prevalent. We're going to be looking at more cash prices and less copays. We're going to see a lot more variability in patient out of pocket, and I think that's going to create a lot of opportunities to just guide to the lowest cost, highest value option.
Let's talk about traction. I want to know when I'm going to start to experience the benefits of this kind of transparency and just like an average visit with a doctor, which I guess is another way of asking kind of where is our RX Review at today? What's traction been like in 2021?
Yeah, I mean, you may already be experiencing it, right? It's we've got a couple 100,000 prescribers or more than that now in addressable in our network. So those are connected to our network and they engage with some regularity. We're connected to 150 million or so health plan lives. That's addressable. So the transactions we can send on behalf of members of health plans. So this is happening at a pretty significant scale. We're doing a little over 4 million transactions a month at this point. So we're driving a pretty significant scale for a growing company.
When you think really big, when you think health moonshot big, what are the downstream impacts of that price transparency that really gets you excited about what RX Review is going to be doing in 2022 and 2023?
I think it's less about price transparency and it's more about informed decision making more broadly at the point of care.
Okay.
Right. Is that what exists today is this sort of, clinical side has an essential platform in an EMR. The payment side has an essential platform in a claim system. What's emerging is sort of this shared decision-making platform in the middle, that the opportunity to connect those two sides of the world, much in the same way that some of the clearinghouses do on the sort of the claims and EMR side, but in the real clinical workflows and driving real-time decisioning and starting to make utilization management, apologies for the jargon, a real-time event that happens, empowering physicians to do it while the patient's sitting in that room. That's what's going to happen. Like, it's inevitability that's where we're headed, right? That's just a matter of how soon and at what level of sophistication.
On one hand, you said that RX Review is really operating at scale, doing great, business, having some great traction this year. On the other hand, you said we're still just an amoeba evolving this whole market. We're still just scratching the surface. And so, still so much opportunity here to really realize the benefits of this at massive scale. And I'm even thinking global scale. I mean, there's a lot of pharmacy tech and transparency happening in India and abroad. What are some of the hurdles that have to be overcome? Some of the kind of the new ways of thinking that have to be normalized for us to see a new level of scale in this market?
No, it's a great question. Well, first, let me clarify something is that, scale to us and a big meaningful scale in the industry is one thing, but our goal is to be a part of $1 trillion of healthcare decisions. So they're out there and they need to be informed. And it's something I think our team feels passionate about impacting in a positive way. So we got a lot of work to do, and we're always going to keep that hunger to look for the next horizon. But, I think there's a lot of really good things happening from a regulatory perspective around liquidity, around access to pricing information, and around prior authorizations. And that confluence of things can be really helpful and interesting. So as pricing and administrative data becomes more readily available, as the patients become more empowered to access their own data, and as sort of some of the baseline requirements or capabilities are now considered mandates, we're creating the environment where this sort of third essential platform is going to have to happen, right? If you look at some of the legislation that just happened in the back half of 2020, those are fuses that were lit on of opportunities in a good way in the industry, that there's just a ton of generativity that'll happen out of those types of changes. So, more of that and sort of leaning into those as opportunities for whether that's the payer community or the EMR community, the provider community, but also for organizations like ours to sort of just get in the middle of it and start solving problems that matter to patients. And that's the type of environment that I think is going to help us succeed as an industry.
Sounds to me like what you're saying is the regulatory environment is set, the mindset is shifting, and people are generally ready. And it sounds like kind of the next pin that has to go down is simply getting in there and starting to really solve those problems one after another, just kind of doing the work. Is that right?
Yeah, there's always got to be an instigator, right?
Is that you?
Yeah, I think so. I think we have the opportunity to be, and our, doing that on behalf of the patient and solving problems that matter to patients, and empowering that relationship between the patient and the provider to maximize the value of each of those encounters is the opportunity we have. And I think that's the leverage point that can really drive a different sort of decision process in the not so distant future for patients and how they experience the system.
I love it. I think that's a good note to end on. Love that you're instigating, you're mixing up this environment. Really cool to see the traction that you've had this year. And I know that you've got some cool things in store for the rest of the year for 2023. So Kyle, thanks for taking the time to update us on what you're working on.
Appreciate it, Logan. Thanks for the time.
Right. Be well.
A quick word about this show, in case you're new around here. At Startup Health, we believe in broadcasting the stories of health moonshot progress, the stories of the most forward-thinking entrepreneurs in health. If you want more of this good news about healthcare's problem solvers, make sure that you subscribe to our channel, hit that notification button, and follow us on social media at Startup Health.